think at EchoHealth Ventures, we've always gone back and said, what does a primary care doc outside of Little Rock, Arkansas need? What does a small employer in Idaho need? These are the questions that this is America. And we really work to make sure that we can try and invest in things that can help them, which is different than what can my friends in Silicon Valley use? And again, there's some of those great opportunities out there, but we really want to start at that regional level and then build up.
Welcome back to the Chilmark Research Channel. Today we are broadcasting from Health, and I am joined by Jessica Zeaske from EchoHealth Ventures. So could you tell us a little bit more about what you do with EchoHealth and what EchoHealth does themselves?
Yeah, great. Well, it's wonderful to be here, and it's actually, of course, just great to be back in real life with people. So that is wonderful. So I am an investor with EchoHealth Ventures. EchoHealth Ventures invests on behalf of 3 different Blues plans: Arkansas Blue Cross Blue Shield, Blue Cross of North Carolina, and Cambia, which is up in the Pacific Northwest. We do have a dual mandate as an investor. We look for financial returns, but also very driven for the experience of the member and the benefit of the member of those Blues plans. And so we really are looking across what is the population health, what are the interventions, what are the solutions that we can really drive to these populations. Now we have rural, urban, commercial, Medicaid, Medicare, et cetera. So we can really look across the spectrum of early stage to late stage companies to invest in to push forth the mission of, again, going back and serving the patients, the members in these communities.
Okay, fantastic. So there's been a lot of focus on improving health equity and improving healthcare access, especially in the light of the pandemic and all the public health issues that have been raised by this huge national health crisis. So could you tell me a little bit about if that's shifted your focus, if that has influenced your thesis at all?
Yeah.
Like, how has the last year impacted what EchoHealth is focusing on in order to better serve those members and patients?
Yeah, no, it's a great question. So, and you know this already, my background originally was in public health. And I actually love to see there are more investors with public health backgrounds coming to the table, because it actually gives you that lens of how does equity, behavioral health, how do issues of access and affordability, these are issues that we are finally talking about on the grand scheme. At EchoHealth Ventures, we've always invested in these types of companies, even back from Circulation, which is a ride-sharing program, to our investment in City Block, our investment in Wildflower Health or Eleanor. These are all companies that were designed to address those fundamental inequities that exist in our healthcare system. And I think when we get in this echo chamber as investors, and we think what is going to be great, and we listen to each other, and then we talk to some early adopters. And I think at EchoHealth Ventures, we've always gone back and said, what does a primary care doc outside of Little Rock, Arkansas need? What does a small employer in Idaho need? These are the questions that this is America. And we really work to make sure that we can try and invest in things that can help them, which is different than what can my friends in Silicon Valley use? And again, there's some of those great opportunities out there, but we really want to start at that regional level and then build up.
Okay. So you mentioned your public health background, so could you actually give us a little bit more history about how you ended up where you are today, and what motivated you to get into healthcare specifically? Because most people I know in this industry, there's a reason that they've fallen into healthcare, that they've pursued a career in healthcare in some capacity. So what's your story?
Yeah. It's a great question, and I always like hearing people's origination stories of how they got into it. So I was doing a PhD in public health, and a man by the name of Carl Schramm came and gave a lecture, who was an entrepreneur. And he said, the issue we really need to look at in this country to truly solve healthcare, we need to follow the money. And follow the money back to that over 50% of our healthcare is funded by the government. We need to follow the money to understand how the reimbursement changes people's behaviors, changes providers' behaviors. We need to understand deductibles and copays and dive in really deep to the money side of it. And it clicked for me. And I was like, I want to go work. And so he was kind enough to hire me on, and we invested together for a number of years. And really got that opportunity to look at how entrepreneurship paired with investment capital can change healthcare markets, can make it affordable, can really change. And again, I work within some fabulous, innovative blues that are bringing change to the market. But you have to have that entrepreneurship and innovation coming and meeting them.
Yep.
And when you get them together, that's where we can really start to see some fundamental change.
So as you're looking at the market right now and how things are shifting constantly, and as we're trying to achieve this quadruple aim, and there's this push towards value-based care that's still getting some resistance from the traditional, more revenue-driving fee-for-service model. Again, I'm going to get back to your investor thesis and what's exciting you right now. What are the top 3 opportunities that you can look at right now from a public health or from the payer side, from your vantage point as an investor with that kind of backing of your LPs?
Yeah, fantastic. So the first 3 areas, let me start with administrative simplification. It's boring, and it is but for the few of us, it's not sexy. But when it's the fundamental of how we drive healthcare to be more affordable, when we talk about how to make it more member-friendly, patient-friendly, we do have to fundamentally go back and fix the pipes.
Yep.
And what is exciting to me is seeing tech entrepreneurs start to come into the industry with curiosity, not contempt, which we actually saw more 5 to 10 years ago, which is, hey, teach me what adjudication really means. I might be able to help out. And so when I say simplification, when we're talking about process automation, we're talking about chatbots, we're talking about smoother pipes to get clinical data back and forth and interoperability. Of course, all of those fall under this administrative simplification. And it's an area that at EquiHealth Ventures, because we work with health plans, we know very, very deeply. 2 other areas that I would say we are spending a lot of time on is one that we talked about some of the equity issues, but the disparities of health in this country. Every single one of our investments needs to be, it's not hey, well, let's go target some CEOs, let's go target some companies. It is every single company needs to be able to address how are they looking at rural populations, how are they dealing with, how do they understand Medicaid? How are they going to work with new Medicare Advantage plans? How are they going to, or geriatric populations? It has to infuse through. So it's not an area, it's CEOs who understand those fundamental issues. And then third, I think there's great opportunity within the pharma space, the pharma services space. I love the convergence that's really coming to this market across pharma, diagnostics, plans, providers. And when we all start to sit around the table, there's some real opportunity there that we're starting early on that one, but we're starting to see some opportunity there.
Yeah, so pharma is definitely an area that we're starting to get a little bit more into as this data begins to get more normalized and more computable. It actually has more relevance to the real world evidence side of what pharma needs to be doing. Okay, so you mentioned infrastructure at the very beginning, which then prompts me for the next question. What are your thoughts on what's going on the Hill right now with the infrastructure bill and all these budget bills and all the discussions around what they might be investing in healthcare or how they might be changing how the federal government funds healthcare in this country? Yeah. Do you have any opinions on that?
Yeah, well, how long do we have? So let's talk about a few things that everyone should be for.
Yeah.
Everyone in this country should be thinking about how we get broadband access across this country. When we look at the telemedicine rollouts and the affordability of telemedicine solutions, this should be a fundamental issue that healthcare needs to step up and be more aware of access and affordability on the tech and broadband side. Second of all, what I said before, when we're following the money goes, a lot of roads lead to DC on this. They are defining the bundling, the ACOs, Medicare policy, Medicaid policy, also the states on that. And then you look at the VA, and you say, this is where a lot of the changes are coming. And I think there's some excitement coming out of that in terms of it's slow, of course, but it is looking at value-based care. How can we drive the incremental changes in some of that value-based care? The directionality is right. Moving away from fee-for-service to that is the right direction.
Okay, so in that final, I guess we can end on this note, but how long do you think it's going to be until we actually see true value-based care be the dominant model? Not necessarily the only one, but the dominant model fully in the majority of finance in this country, as far as driving the economic activity in healthcare?
I will say I think it is going to be regional for a while.
Yep.
I point to Blue Cross North Carolina as a leader in this space of really moving that Blue Premier, and the cost savings are showing up for them and for their members, more importantly, in that state. So if I look, I can pick out pockets of states and say, hey, I think those 10 states, now these 15 states, until there is true Medicare change and then it becomes federal, there are states regionally. We sit in one of them. We sit here in Boston, Massachusetts. Like, it may be longer for Massachusetts to get there, but it is, we will slowly get there. So there's not a magic number in that, but I will see state by state, we're starting to see that innovation come.
Do you know what will be what will actually cause that switchover? Because right now, there's a lot of resistance to value-based care. A lot of people want to keep doing the fee-for-service model because it's so easy to rely on.
Right.
I mean, the pandemic obviously put a very clear, this is what could happen. You have your patients already covered and they're already paid for. And so now there's this pandemic and people aren't getting all their electives and they're already paid for. So
Yep.
there's a benefit there. But outside of these big kind of one-off acute events like a pandemic, like what we just experienced, what do you think might finally get more of the provider side? Because you mentioned that it's good for the patients and the payers, but what about when are we going to see more providers buy into value-based care?
It actually can be excellent for the providers. But not
That's
all
our feeling.
providers want to move to that, and it's one of the reasons we're investing in companies across the board who are pursuing this way, like Strive Health and Heartbeat Health and Vori, and companies that are really driving to create a new provider model.
Okay.
To enable that value-based care. Alidate and CityBlock, all of these companies are in that space, because I think once there is some competition, there is some push, partnered with, and I'll come back again, the fundamental change in the reimbursement model starts with the payers. Starts with CMS, starts with the health plans that are writing those reimbursements. Once those start to move, the providers will follow.
Yep. Well, thank you for joining us today, Jessica.
Yes.
This has been great. It's always wonderful catching up with you. For those of you that aren't aware, which is most of you, Jessica was one of the first people that was kind of welcomed me into the healthcare IT space when I was getting started. So we've had a long-standing relationship, and she has a fond place in my heart.
Thank you. Yeah, well, it is great to be here, and I'm a supporter of the work you guys do at Chilmark, and great to see you here at Health.
And thank you, Health, for having us out here, and thank you, everyone, for watching.
Yeah, thank you.